Hi class! In this last video, we're going to be talking about treatments. And I know that we've talked a little bit about evidence-based treatments before, so we're going to keep going with that and talk a little bit more about different types of treatment options. So unlike Lucy telling Charlie Brown to just snap out of it, treatment involves a little bit more than that. And one of the things that we want to do is actually conduct research on this, which is why we were talking about evidence-based therapies in our research methods section. So the research that we really want to do is find out whether or not therapy is generally effective. So is it better than not doing anything at all? What about particular therapies? So is behavioral therapy or cognitive behavioral therapy better than doing nothing at all, or better than one another? And then are there particular therapies that are effective for particular problems? So once we get to this very last question, we now are talking about our evidence-based therapies. Is this particular therapy effective for this problem? So is behavioral treatment effective for autism? And if we say yes, and there's enough evidence for it out there, then we say that this is an evidence-based therapy. So if we take a step back, we can have different types of treatments. We have a whole host of different interventions that we can try. It is not only individual one-on-one treatment, right? So we could have things like just health promotion or some sort of positive development. So potentially a whole school will have meditation that they do. We can have kind of selective prevention. So maybe we know that this type of child might be at risk for depression. So maybe we should give them some coping skills to manage a potential depression episode. We might have time-limited therapy. We're only going to do 6 sessions, and that's what you get. That might be something that we see in a counseling center on a college campus, for example. And we can even have things like continuing care, so just kind of following up. So for example, if somebody goes into the ER for suicidality, we might want to follow up with them and make sure that they're still doing okay. So talking about that, we have inpatient units, which is really where you stay all the time. You're doing therapy there to recover. You're going to be watching a video trying to get a child some inpatient therapy. We also have like outpatient clinics. So if you just go to a school counselor or maybe one that's associated with a hospital, for example. There can be school, there can be home-based interventions. So we have these different types of interventions, different types of settings, and we can interact with them on different levels of care, right? So we might want to match certain interventions based on the presenting problem, so what they're actually coming in with, how we've assessed them, right? So, and then also based on their different identities. So things like culture might matter a whole lot. We're going to be delving into culture next week, and I think it's really important for us to really talk about how a lot of this therapy has been developed by people that are weird and come from weird cultures. So we really need to be talking about a multicultural perspective of interventions. So how do we actually know which therapy is best? Well, we can do research, like I was talking about before, but we really should be considering all these other factors. Who the therapist is. So what type of therapist do you want? Do you care about credentials, for example? Licensure is really important. We're talking about making sure that we have ethical things that therapists are doing. What type of therapy is going to be best for a particular type of disorder? Who is the client? So again, really thinking about what specific circumstances that client is going. Where do you actually go to seek help? So a lot of people are constrained or are limited in where they can go based on their insurance. So some places don't accept insurance, some places do, and if your insurance doesn't match, that could lead to a really high cost. So that's all part of it, right? So sometimes we're limited in what we can actually do when it comes to therapy. Sometimes we don't have access. So if you lived in a more rural community, you would have a little bit less access to different types of therapies. So we know that there are some common factors that can help with therapy and making sure that therapy is successful. And one of which is called the therapeutic alliance. So this is that working relationship that the client and the therapist will have together. The therapeutic alliance is really, really important to therapy outcomes. Above and beyond the treatment modality, so saying it's behavioral treatment or humanistic treatment or anything like that, the quality of that alliance is really important. That predicts better treatment outcomes than anything put together. So, my own therapy experience, at first I was very against what my therapist was doing. I was trained very rigidly to believe in evidence-based practices and evidence-based therapies. And I was going in for anxiety, and I was like, all right, I'm expecting you to give me cognitive behavioral therapy, and that is it. That's what I really want. Instead, she was doing a more humanistic approach and really thinking about me as a client holistically, rather than challenging my thoughts and doing behavioral experiments. At the end, it didn't matter, because what mattered the most was that therapeutic alliance. I felt that I had somebody that I could trust, would sit with me in my discomfort, and would acknowledge me for who I was. And that therapeutic alliance just made that therapy and made that a really important aspect. I know that anecdote does not mean data, but we do see, even in this research, so backed up by research too, the therapeutic alliance is really important. So you may be asking yourself, do therapies actually work for kids? And hopefully you remember this effectivechildtherapy.org, which is the APA Division 53. And yes, we do know that therapies do work for kids. We know that there are evidence-based treatments out there. So we have that research evidence. But there's two different ways that we can define that. Efficacy really talks about if I have optimal conditions. So I am running a research study, everything is controlled for, the children only have one diagnosis, and that is separation anxiety, and I am really well trained as a therapist to deal with separation anxiety and track them over time. That research study has a lot higher chance of actually working because, well, we're really controlling our environment, we're controlling who the clients are, and we're making sure that the therapist is really well trained. That's efficacy. However, that's not what happens in the real world. In the real world, we have a different type of measure called effectiveness. So let's say we find treatment A that works really well in that research contest for separation anxiety. Now I want to make sure that everybody has the opportunity to have access to treatment A. So I might try to train different clinicians across the country, and they may try out treatment A for separation anxiety. So we want to make sure that it really is effective in those environments too. So we might want to follow up and make sure that separation anxiety does decrease over time for a lot of those children. So something to note is that if I've gone through this assessment, I figured out a whole host of things that that child is going through, and then I start to have that case formulation. I think, part of the cause of the disorder is biological, or maybe it's cognitive, the way that child thinks. Maybe it's environment, or social factors or family factors. How would I go about treating that child? Well, that assessment is going to lead to my treatment outcome, or the way that I'm going to approach treatment. So for example, I might say, hey, I think the way this child is thinking is the thing that's really making them feel depressed. Well, then I might want to target cognition or thoughts in my treatments. So as a quick overview, we'll talk about different types of treatment modalities, one of which is behavioral treatments. You'll see this a lot with kids. And the underlying assumptions that we have are that your behaviors are learned. So we then believe that if these behaviors are learned, that we can either unlearn them or learn new behaviors. So that's what we mean by re-educating a child. So things like positive reinforcement. So if I think that that child's behavior of getting up out of their seat is due to them feeling frustrated, giving them positive reinforcement when they feel frustrated and sit in their seat can actually improve that behavior. Or maybe if that child is getting out of their seat because they get a lot of negative attention, then removing that attention and putting them in timeout might be one way to treat that behavior. We also have things like modeling. So going out, if we talk about phobias and we have a phobia of escalators, modeling or watching somebody that you know and care about go take escalators up and down, that might help them to model that behavior. We also have systematic desensitization, which we'll talk about more when we get to anxiety disorders. But basically, we're desensitizing a child to that experience of anxiety. And we can also do things like change our child's environment. So if we know what the triggers are for their outburst, for example, we might think about how to change that child's environment to better suit them so that they don't get triggered. We have cognitive therapies. So again, if I think the thoughts are, if there are abnormal thoughts that a child is dealing with, that I might want to focus in on thoughts. So I really like the 3 C's, the catch, check, and change. So identifying that negative thought. So if that negative thought is, I'm a failure, we can check on how accurate that is. Well, why do I say that I'm a failure? Well, I didn't do so well on my first quiz. Well, let's check what other evidence do we have against that thought. Well, I did really well on my second quiz. So we might want to check it and change it. So what is a more useful thought, or how can we change it to be more realistic? So it might be, oh, well, I didn't do so well on my first quiz, but I did really well on my second quiz, so it'll be better if I make sure I study for the third quiz. Cognitive behavioral therapy is a combination of both the cognitive and behavioral therapies. But really, we're talking about thoughts, feelings, and actions all interacting at once. So we can change those cognitions, right? Thinking I'm a failure, but we can also change different types of behaviors. Hey, let's try it out. Let's see what happens when you study for quiz number 3. What happens to your grade? For family treatments, we really look at the dynamics in the family. What's going on in this family system? How are parents treating their children? How are parents treating each other? How are children treating their siblings? And we look through all of these dynamics to really focus in on those relationships. And so family therapy is really thinking about those family relationships. So as an example, this lack of boundaries, right? So having a child that, this is a common thing, you gotta live my dreams, says the parent. So maybe the parent believes that their child needs to go into the sport that they went into. So a parent might believe that their child needs to be a good baseball player because they themselves, were a baseball player, but they only got to, play at the high school level, but they want their child to play at the college level, right? So fulfilling those dreams and criticizing them when they are not fulfilling that. So we might look at that family system and say, hey, let's change this dynamic so that the parent doesn't feel like that child needs to do this thing, or the child might be very unhappy because of this. We also have biological treatments. So this is oftentimes when we talk about like psychiatry or treating the disorder using medications. Oftentimes we think about it as being biological in nature of some sort. So this is oftentimes, we do have evidence to suggest that there are some helpful medications, for example, for childhood depression. So we might prescribe those medications. But something that's really important that we should know is that there are some data to suggest that children are given medications off-label, which means that they are not approved for children, yet they may be approved for adults or may be approved for a different type of disorder. And this is often the case because we don't have that many clinical trials with a lot of different disorders for children. So we really have to think about that from an ethical standpoint. Yes, this medication may help, but is it going to? And also, what does that do for a developing child? So something that you should really consider. The last little bit I want to get into is this complementary and alternative medicines. These are gaining more popularity as time goes on. So for example, this is just from 2012-2017. Things like yoga have increased in children. Children are more likely to be meditating. They're about the same to go to a chiropractor. But these CAMs are really just things that are slightly outside of the realm of conventional medicine. So, by that we really mean Western medicine. So if you are using herbs or other types of remedies, those would be kind of these complementary and alternative medicines. And I wanted to show you some data. This comes from a research article in 2018, although this data comes from 2012. And what they looked at is, do children who have mental health conditions, are they going to use different types of these CAMs, so these complementary and alternative medicines? And what you see is that in general, children who have a mental health condition, which is in that light blue, are more likely to engage in these CAMs than those who don't have a medical condition, or mental health condition, sorry. So CAM usage is up here around 17% in children who have a mental health condition like anxiety or ADHD, for example, where it's more around 10% for children who don't. And I just thought it was really interesting to look at. This is the case for all of these. So this is the end of this video. I want you to reflect back. What are 3 important things that you should learn about assessment, diagnosis, and treatment? And hopefully that will help you kind of think about these different things a little bit more.